This is the work experience that landed me an offer to study medicine at King's College London, the 15th best medical school in the world. Right, let's go. So first and foremost, I'm in year 13 right now, so I'm waiting for my A-level results. But when I was in year 12, every Wednesday after school, I would go to a care home that was located fairly close to my school, and I would interact with this 96-year-old that suffered from vascular dementia. And whenever I'd go there, in the first couple of weeks, I would just sit there like an alienated individual looking at these people as if they were shells of their former past. I was really alienated and sympathetic. I wasn't empathetic. Okay. And what I realized after a couple of weeks, after interacting, was that there is something profound going on here. I mean, dementia it's a significantly impactful disease that tears apart families and has a monumental impact on the family structure as a whole. But when I was talking to this guy, the guy literally told me, I am like a fountain of knowledge, but the water's running out. I was literally like, you know what, this is crazy. This person had the most strongest long-term memory, but his short-term memory was weak as hell. It was like a stack of cards, and then pew, all came crashing down. Now, I'm telling you, this man went to the same grammar school that I did. He had the most succinct, clear, and concise memory of what happened in school. He had everything. It was elaborate. It was clear. It was distinct. However, when I asked him, where did you put your newspaper that you just read like 20 minutes ago, he was like, I have no idea. And I reflected upon these events, and I reflected upon the fact that being a doctor is basically blending clinical practice with science, and that is something that I want to do. I think that's the way you can differentiate between whether you want to be a doctor or you just want to study science, because the blending clinical practice part is essentially when you instill empathy when you're articulating to a patient, or when you're having that one-to-one rapport and developing it and nurturing yourself to be delivering holistic care and trying to really understand what's happening to the patient, rather than, as I said before, when in the initial phases of when I went to the care home, being this alienated individual. So I think for your work experience, what you need to do is you need to make sure that you reflect upon every experience that happens. I did an EPQ, so I did my EPQ about what are the most significant factors influencing depression for the elderly in care homes, their impacts, and the most effective treatments. I'm not saying you have to, but it gives you material to talk about in your interviews. Now, what else? So in my opinion, as long as you self-reflect, you talk about empathy, you talk about what you learn, why that links to being a doctor, then that is sufficient. You just need to be able to articulate about your work experience thoroughly in an interview, and it needs to be relevant. But other than that, that is all you need to know. I did a bit more research into dementia, and in particular for me, it was an area of personal interest, but it might not be for you. So all you need to remember is that whenever you go, because you'll go to a care home, you'll go to a hospital, you'll go to a GP surgery, you need to find something interesting, self-reflect upon it, and how that relates to being a doctor, why it relates to you, and then that's it. Thank you for watching.